biosecurity, on the other hand, is simply a range of measures to prevent dangerous biological materials, whether accidentally or deliberately, and it reduces the risk of loss, theft, misuse, and diversion of these biological materials. So simply put, it's keeping bad people away from the bugs. So you see the two differences between biosafety and biosecurity, but they are concepts that go hand in hand, and people use them in the laboratory, within different NGOs, within global health and public health spaces as well. This next slide just shows an illustration between biosafety and biosecurity, and I found that recently, I think sometime last week, in one of the biosafety networks that I belong to, and I said I was definitely going to include this in my presentation. So you see one of the pictures here is a lab scientist, the researcher, wearing personal protective equipment, and that's basically biosafety, protecting researchers from germs. And here you see biosecurity, which includes cameras, security, locks, keys, and this is protecting germs from bad people, ensuring that biological materials are not stolen or used for harmful purposes to cause disruption to the environment and to human health. So next, I would like to paint the current picture of biosafety and biosecurity landscape in our world today. Globally, the knowledge of biosecurity and biosafety have extended to address threats to the economy, to our environment, and to human health. And some of these threats include global health events like the COVID-19 pandemic. And we saw how that altered our world and our everyday lives. So those are areas where biosafety and biosecurity come in, and they are key concepts that need to be thought about, that need to be strategized and prepared for. We also hear about emerging infectious diseases such as Ebola virus, Zika virus, and there's also an endemic outbreak of meningitis in Kent in the United Kingdom. And these are areas where biosafety and biosecurity can come in to ensure that these diseases do not spread and they are contained, and the harm to the environment and to human life is managed properly. There's also biological advancements within gene editing and expansion of high containment laboratories in our world today. Those are key areas where biosafety and biosecurity are looked at. And there's something called dual use research, which is basically both beneficial and potential misuse of biological materials that can cause bioterrorism and bioweapons threats. So these are areas where biosafety and biosecurity are spoken about, are found on a global scale and on a national scale as well. And while I've talked about global health security, biosafety, and biosecurity, I would like to talk about my own personal journey in the world of biosafety and biosecurity. BSBS, like I like to call it, is not something I learned about during my undergraduate degree, but something that I came to understand while I was already working. And it was during the COVID-19 pandemic response, having to do triple packaging, having to ship biological materials, having to prepare documents talking about biosafety and biosecurity. I had to learn about this terminology and also work on it hands-on in the field, which was very interesting because it was sparked by inquisitiveness and also being surrounded by these things and trying to understand them more. And part of what I did in the space of working at the NCDC, I applied for the Biosecurity Diplomacy Workshop, which was a great opportunity, and it was organized by the United Nations Office of Disarmament Affairs. I got to learn about more on biosafety and biosecurity, speak to experts, and meet a lot of experts there who have shaped the course of my career since 2022. I was also in the Global Mentorship Program organized by IFBA, where I worked on projects with global mentees on concepts around biosafety and biosecurity within public health laboratories. And then this also led to being part of one of the 5 amazing authors of the Biosafety and Biosecurity Handbook for Students in Nigeria, which is also on a copy is on the UN website. We have had copies delivered to various secondary schools across Nigeria, and we received funding and huge support for this project, which is also a way to give back to the community and increase the knowledge of biosafety and biosecurity. And recently, I was also part of a Blue Dot Impact program, learning about biosecurity fundamentals. And I got to work on a project with one of the global experts in this field as well. So that has been my personal journey in the space of biosafety and biosecurity, coming out of undergraduate degree and learning about this in the field, and just growing more and more in the area, working with experts, partnering with people in networks such as the Biosafe Advocacy Network, just to learn more and also pour out the knowledge that I have within the space. So this will now lead me to some of the opportunities that I have researched on, some of which I've also benefited from, opportunities for young people in the space of biosafety and biosecurity. I will share some of the links to these conferences that I know are taking abstract submissions, publications from young people who have ideas on biosafety and biosecurity, or even global health security that they will want to submit and key into. So the first is the UKHSA conference in 2026. This is the United Kingdom Health Security Agency conference. And this conference is holding in September of this year in Manchester, UK. And abstract submissions for this conference will open soon. So if this is an area you're interested in, you can keep an eye out on it to register for the conference and try to write out an abstract. Even if you don't want to do it yourself, you can collaborate with someone in your workspace or your peers or someone in any of these international or national networks and write out an abstract. An abstract is about 300 words. So you can just write out something. It doesn't have to be something that was done in the lab. It could just be a policy or a concept or an idea that you would want to push out to any of these conferences. And I know that this is a big one and it's taking place in September, and you can register for that. There is also the Global Health Security Conference in 2026, and this is taking place in June in Malaysia. The link is there. You can register for that, and you can also apply for sponsorships to apply to attend these conferences in person. There is the 15th International Conference on Global Health Challenges, and this is taking place in September in Barcelona. And they are currently accepting paper publications up until June 2026. So if you have any paper that you've written or you have any idea of any paper that you can work on, this would be a very good conference to submit your abstract or your paper publication to. There is one in Africa called the International Synthetic Biology, AI, and Biosecurity Conference, and this is taking place in Accra, Ghana. This is a conference that is holding in October 2026, and the link is there where you can register. There is the Global Infectious Disease and One Health Conference. This is a hybrid conference, and abstract publications are still open. It's taking place in September in London, United Kingdom. There is the APSA Annual Biosafety and Biosecurity Conference, and this is a big one. I know individuals that have benefited from this conference. They have submitted abstract publications and received full funding to attend the conference. It takes place in Alabama, USA, and it's in September, and abstract publications and submissions are open up until the 30th of March. And this conference is so big, it's a hybrid conference, so it's in person and it's virtual. So if you're not able to attend in person, you can attend virtually. There's another big one within the European Biosafety Association, and this is taking place in June 2026, and abstract submissions are still open for this. There's other things that you can also apply for if you don't want to submit papers or abstracts to conferences. You can apply for internships within global health organizations, such as the WHO, the African CDC, the US CDC, or the World Organization for Animal Health, because biosafety and biosecurity is a concept that spans across human health, animal health, and the environment. So there are multiple organizations, not just human health organizations, but animal health organizations and environmental health organizations that sponsor internships. And these are very good opportunities for young people, and I can assure you of that. You can volunteer into organizations such as the Biosafe Advocacy Network, NIPSA, APSA, FABA Nigeria. You can volunteer to be part of that and also benefit from webinars such as this. And there are exchange programs that you can be part of. I have searched on 4 global health programs, global health fellowships that one can apply for. I know people that have benefited from this, and I have benefited from it myself. There is the International Genetically Engineered Machine IGM conference that you can apply for. There's also the ICGEM fellowship. This is in March 2026, and applications are still open for this. There's a Youth for Biosecurity fellowship by the UNODA. I know that the 2026 applications are closed, but if it's something that you're interested in, you can apply for the 2027 one. Now you can start to apply for conferences that would help you boost your chances of getting into such huge fellowships. And this is a very big one because you get to travel to Geneva and have some in-person sessions in Switzerland. And that's a very good one as well. There's the Emerging Leaders in Biosecurity Fellowship. And this one, the 2026 applications are closed, but it's a big one in partnership with Johns Hopkins. You can look into the 2027 applications when that opens up. And there is one organized by the African CEC, the African Public Health Emergency Management Fellowship. This is the 3rd cohort, so it's something that is still fresh, and applications are still rolling in for 2026. I know that the applications end by 31st of March. So if it's something you're interested in, you can look into it, start to work on your applications, reach out to experts or even people that you know that have benefited from this. They can help you review your essays and your applications. And you never know, you might get into one of these conferences. And as a young person, if some of these things sound so humongous to you, you can start by simply doing a few things, taking global health courses. There are links to Coursera courses on Introduction to Global Health, where you can learn more about the field and see other areas, not just biosafety and biosecurity, that you might be interested in. There's the Global Health Network Training Center that has free courses on global health security, biosafety and biosecurity. And there's also Future Learn. I know there's a course on next generation biosecurity that is free and comes with a certificate as well. Not just a certificate, but growing your knowledge in the field. And these are things that you can learn about that would increase your chances of being accepted into some of these conferences and some of these fellowships. So if you don't want to submit abstracts, submit papers, you can take courses, you can enter in for fellowships, you can join networks. But these are ways as a young person you can key in and join the space of biosafety and biosecurity. And there's an illustration here that says, dream big, set goals, and take action. As a young person, we have so much time, and we can keep trying different things. The world is so huge, and there are so many spaces that we can work in. All we need to do is try, take action, apply, take that one step that can change your whole life. You can get scholarships, you can get funding from any of these places. You can meet experts that might be your bosses in the next few years. And this might be very, very key in your career and how you move from one place to another, how you get from one job to another. These are places where I know that I have benefited from, and I know that fellow experts have benefited from. I've met so many people in these networks, and it's really a privilege to speak here and talk to you about my journey and share some of these experiences that have been useful to me and my colleagues. And now this slide just talks about career opportunities within biosafety and biosecurity. The list is endless, but I picked out a few and I put them in a few headings. So there are global or public health roles that you can work on. You can be an epidemiologist, you can be a public health officer, you could be an outbreak response coordinator, you could be a disease surveillance specialist. And these are roles that you can work as with the knowledge of biosafety, biosecurity, and global health security. And if you don't want to go for some of these desk roles and you're interested in laboratory or scientific roles, you could be a biosafety or biosecurity officer, you could be a virologist, a microbiologist, a biochemist, you could be a research scientist and work on different things in biosafety and biosecurity. There are also roles within advocacy, communication, and education. You could be a science communicator, you could be a global health advocate, you could be a program officer like Faith here. You could also work in policy, regulation and governance. You could be a policy advisor to the government or to non-governmental organizations. You could be a health policy analyst or regulatory affairs specialist. The list is endless and opportunities come every single day. But before you get these opportunities, you need to grow in the space. You need to grow in the knowledge. You need to grow in the experience. You need to have a network of experts that will be mentors and will guide you as you progress in your career. And in conclusion, like I said, seek mentorship from experts. I have so many mentors that I can always talk to, and I've met them in rooms and in conferences and in fellowships where I've applied for and I've gotten in. You can collaborate with your colleagues. While I was at the NCDC, I worked with my colleagues to write abstracts on work that we were doing within the lab, and we submitted to different publication houses. We submitted to different conferences that we got to present our abstract in. Those are opportunities that you can key in. You can start by collaborating with your peers and your colleagues. You can explore various areas of global health. There's so much more in global health security, within biosafety and biosecurity. And you can only explore these areas if you know about them. So doing those free online courses, joining those networks, joining those fellowship groups are ways to explore more areas in biosafety and biosecurity. And the last thing is network, network, network. Network, join volunteering organizations such as Biosafe Advocacy Networks. Join any of these groups, work with these aspects, write to them on LinkedIn. I'm not assuring you that everybody you write to will respond, but for every opportunity you reach out, you put yourself out there, someone will respond to you. One of it will work. I can't sit here and tell you that every single fellowship or every single workshop I applied for, I got in. No. I've applied for so many, and maybe only 20% of them I was able to get in. So it's just the thing of putting yourself out there and trying, knowing about these opportunities, applying for them, working with colleagues, submitting papers, submitting abstracts, and just keep trying, and something will definitely work, and I can assure you. And here's just an illustration of one of the quotes I go by. I found this in my manager's office while I was at the NCDC, and it says, challenges are what makes life interesting, and overcoming them is what makes life meaningful. So those are just things that I have come across and I would like to share with you. I hope anybody here found it useful. And if you have any further questions that I might not be able to take after this presentation, you can always write to me on LinkedIn. I will try my best to respond to you and share whatever information or answer whatever question you have to the best of my knowledge. Once again, thank you so much for taking out your Friday evening to listen to me. If you have any questions, I would answer to the best of my ability. And yes, that's it from me. Thank you.
Oh, wow, that was a beautiful presentation. Please let's show our speaker some love. Use the emoji. Please appreciate her. She has spoken beautifully well, and I'm sure we've learned something. If not for you, I personally have learned a lot. And she just gave me some opportunities I'm going to apply for. Yeah, so please show us some love. Thank you so much, Augusta. That was beautiful. Thank you very much. Thank you, thank you, thank you. Right now, we're going to be moving to the interactive section. So if you have questions, please use the raise hand icon, or if you don't want to speak, you can use the chat box. Thank you very much, Augusta. That was insightful. So please use the chat box, or you raise your hand if you would like to speak. So while we wait for questions, yeah, I'm seeing a chat. The presentation will be shared across to all registered participants. The presentation will be shared. So right now we have a question. I have a question for our speaker while we wait for others to drop theirs. If you guys don't ask questions, it means you've not learned anything, because I heard a saying that people would have actually learned something will ask questions. So it means something is wrong with our presentation and our webinar. So please think about a question, think about something. So I have a question for our speaker. What is that one thing young people often misunderstand about entering the biosecurity and biosafety space? What is that major misconception and misunderstanding about that space?
Okay, thank you so much, Faith, and thank you for all the emojis. I wasn't seeing them while I was doing the presentation, but when I came back, I saw them. Thank you so much, everybody, for all the emojis. And somebody said, we hope to get the presentation. Yes, you will get the presentation. Faith said she will share that. I will share with her and she will share, of course, with everybody. So, Faith's question, what is the misconception about getting into this space? I think the misconception for young people is that it's difficult to get into. I promise you it's not difficult. Just one opportunity can change your life, because one opportunity changed my life. I was just I'll give an example. I was just working in the NCDC as a copper, as a core member, as a lab staff. And while I was there, I saw how my colleagues, my senior colleagues, how they wrote abstracts, how they got into conferences. And I wrote one application, and my mentor at my workplace reviewed my application. And that was how I got into the Biosecurity Diplomacy Workshop Fellowship workshop. And just that workshop has trickled so many events in my life. And you can see how just one big break can change your story. So it's not difficult to get into. It's not difficult to get into. Just apply, just keep putting yourself forward, just keep putting yourself out there, and somebody will definitely say yes. One application will definitely click. And I don't think any industry is difficult to break into. And biosafety, global health security is not that difficult to break into. It just takes applying. For example, if you apply for the Biosecurity Diplomacy Fellowship in 2026 and you don't get in, you can use that as a learning opportunity to better your submission for next year. You can reach out to people who got into the program during the year that you applied for and ask them, oh, can you help me review my essay? Can you tell me what I need to do to better my chances of getting into this opportunity next year? You just have to be resilient and keep trying, and you will get your big break eventually. Something will come through. So I don't think it's a very difficult space to break into, at least not for me or any of the people that I know. So I think that's the misconception that young people have.
Yeah, thank you, Augusta. That's beautiful. Also, from my personal experience, similar to what Augusta said, I also joined my organization as a COP member, and I was exposed to biosecurity and biosafety. By the way, I have a microbiology background, so I never really knew what biosafety and biosecurity meant, even though I worked at the lab. So when I got there, I got the opportunity to apply, and yes, I did apply for the UN Youth for Biosecurity Fellowship. I gave it to my mentor to review for me. That is my boss at work as a then. And she did review when I got in. And that's how I started that journey, and I'm still in the journey. So it is not very difficult. You just need to, like you mentioned, identify these opportunities and be intentional. Go out there, take some courses. So after getting these opportunities, eventually you are not just dull there, you don't know what you're doing. You actually don't know what you're speaking about, and you have the knowledge. So yeah, it is not that difficult to break into the space. I can see we do not have question. Yes, I still have one more question for
Some people's
our
hands are raised. I can see
people's
Soma's
answers.
hand. Yes, Soma's hand is raised.
Okay, that's okay.
Soma, do you want to ask your question? Oh, I think he needs to be unmuted.
Okay. Hi, everyone. Good afternoon.
Hi.
This is a good presentation. Thank you very much for this opportunity. I am Soma Jifahamai from Burkina Faso. I am a postdoc researcher. So thank you for this opportunity again. My question is about, I apply many times for this kind of training with Africa CDC. But at many times it was not, for this moment, I don't have opportunity to participate on only one training. I didn't have this opportunity yet. Because at the most moments, they say no, they need people from public health laboratory, National Institute Public Health. So at the university, we don't have really opportunity to participate in this kind of training. If no, I apply at many times. But the last information that I get is I'm in university, even I'm microbiologist, but they need people from public health laboratory. So my question is, how what can I do now to get this kind of training or to participate? Also about the abstract submission, what kind of abstract? Is it abstract from microbiologists or it is only from biosecurity training? I don't know. Because I'm in microbiology, I'm working in One Health approach and AMR, for example. Can I apply with this kind of abstract, or my abstract should be focused on biosecurity and biosafety? Thank you very much. I don't know if you understand my question, because I'm in Burkina Faso, our English is not so good. So I hope you understand what I want to say. Thank you.
Yes, I do, Soma. Thank you so much for your question. So it's not strictly about people in public health lab. I have a degree in biochemistry, so I was in a virology lab, and there are different abstracts you can write about. So some of the abstracts I had written about was about specimen transportation. And some of these conferences, they have different topics that you can write on, not just biosafety and biosecurity. They have AMR, there are different topics you can write on. Once you get the presentation and you click the link to any of the conferences that you're interested in, you will see different topics. There are some on biosafety, there are some on One Health. Different conferences ask for different things. So being in a microbiology lab is still One Health. One Health is still global health security. So you are definitely aligned. And because none of your applications have been approved yet, it doesn't mean you should stop trying. I think you should really look into the African CDC fellowship that they have. I saw it recently. I'd never heard of it because it's pretty new, and this is just the third cohort. But I think you should key into that. It's the African Public Health Emergency Management Fellowship, and you can apply for that. You can get references from your lab, and you might just get in. For the conferences, there are different types of conferences. Some of them are around global infectious diseases, like the one in the UK I gave you an example of, that was around global infectious diseases. So some of the work that you do in the microbiology lab can also be written there. And it doesn't always have to be a publication that has already been out. Like when we first submitted our specimen transport abstract, we had never written any publication, and that was the first time we were writing about it. And it got accepted into I think it was the African CDC conference at that time. So you can write about anything. An abstract is about 300 words. So you can collaborate with maybe a senior researcher and write an abstract of 300 words and submit to any of these conferences. And somebody will definitely be interested in what you're saying. Just make sure that you have a tight abstract. You get it reviewed by experts or colleagues that have more experience, so that they can help you write out or submit a tight application. And I definitely assure you that one conference would accept one of your applications for the conference, or even abstract submissions. So if you have an abstract submission approved, next year, if you're applying for something, you can include that in one of your essays, and it will increase your chances of getting into any of this. So I hope I've been able to answer your question. The next person is, I think Oluwatobi's hand was up at some point.
Yeah, Oluwatobi can speak. Hands were raised. Do you want to unmute?
Yes, thank you. Good evening, our speaker. Thank you so much for the explicit speech you rendered. Sorry, teaching you rendered. I'm a medical laboratory scientist by profession. That's my first degree, and currently I'm running my master's program in public health. And the goal is actually to migrate into the global health space. And you talked about some fellowship that we could join, but while you were speaking, I was just trying to say the one African public health emergency you talked about. Is there other one you can actually recommend, or probably suggest for us so I will be able to explore more opportunities into the global space? Thank you.
Um, yes, thank you so much, Oluwatobi, for your question. About the African Public Health Emergency Management Fellowship, there's a link in the presentation, and Faith is going to share the presentation with everybody. So all the conferences and all the fellowships that are in there have hyperlinks that you can click, and it will direct you to their website. So you see if it's something you're interested in. So I made sure to take out the time to put all those hyperlinks. So when you get the PDF version of the presentation, you can just click on it and it will take you to a website. And since you have a degree in, sorry, I can't remember what your first degree is in, MLS, and then you're doing a master's in public health, that's a very good way to transition into the global health space, because you have the experience of being a medical lab scientist, and now you're getting the public health experience. So these are things that you can put to make your application stronger, and you can apply for them. And also, another thing that I would advise is, if you can find out people that have gotten into these programs, that's one thing that worked for me. When I applied for the biosecurity diplomacy workshop, I found somebody that got into that workshop in 2021 while I applied for the 2022 session, and they helped proofread my application. They provided advice. So if you can link up with somebody that has gotten into that fellowship, and they can advise you on what key points you need to highlight within your application to make your application stronger and stand out, that would be so helpful. But even if you can't, just maybe your mentors or senior colleagues at work or somebody in your public health class can help you proofread your application. I think it's very important that you find somebody to help you proofread your application, because if you apply for something, you're the one writing it, so you understand your story better. So it's always helpful to have somebody with an outside lens to look into your application and say, oh, the story I'm trying to say, is that correct? Do you understand what I'm trying to say? Do you think I should include this, include that, or how to word things differently? So yes, just try and approach that in that kind of way. Get people to review your applications before you submit, or you could use AI. Or I don't trust AI that much, because some of the people that read these applications or approve these applications are human beings like us. So there needs to be a human feeling, a human connection in your submissions. That is why I would advise that you give experts or your friends in your public health class to kind of look through your application and see if there's any way you can make it stronger or better. So I hope I've been able to answer your question, Oluwatobi. I know
Yeah,
that
thank you so much.
Bar has his hand raised.
We have Bar, and we have one question in the chat box. So after Bar, we're going to take Dima's question. Bar, please go ahead.
Okay, thank you very much for this presentation and interesting program. My name is Mamad Bundukuraba. I'm a PhD candidate on microbiology and a researcher at the Institute of Research and Biology Appliquée de Guinée. My application based on the abstract. Sometimes I use a see the application call, but they ask about abstract. The abstract, is that mean a specific talking about biosecurity, biosafety, or you can submit like a topic, like someone who are working on dengue fever on the talking specifically about biosafety and biosecurity. My question is that, please.
Okay, thank you, Bar. You say you're doing a PhD in microbiology, which is also a key area in global health security. So when you see call for abstracts, you can write about anything. It depends on the abstracts. It depends on the conference you're submitting to. If it's something like, let's see, the APSA conference now, you can write about anything you do in your lab as a microbiologist, as a PhD person, or if you have any paper publication that has gone through already and has been published, you could just take the abstract and put it into the word count for the conference you're applying for. It's usually around 250 to 300 words, and take that abstract and submit it. So for global health conferences, you can write about anything. You can write about anything. The conference where we submitted an abstract on specimen transportation. It was a global health conference. So you can write about anything. Microbiology is also part of global health security, and you can look into that. So just make sure that the abstract you're submitting to is an abstract, the conference you're submitting to is a conference that caters for a broad group of people. And also some of these big conferences, they have different categories. I remember we applied for one that had lab category, that had public health category. So you just pick the area that interests you the most. I think for abstract submissions, you need to find a conference that is in line with what you have already, or even if you don't find a conference that is in line with what you have or what space you're working into, you can always tweak whatever you have to fit the specific need of that conference you're applying to. And I hope that's been able to answer your question, Ba. I see there's another question on the chat.
Yes, you answered my question. I really impressed about your communication and your background. I
Thank
hope
you.
you can be a real mentor for me. Thank you on Biosafety Biosecurity.
Thank you.
Oh, that's so sweet. Thank you. Okay, so do you want to go through the question or I should read it out?
You can read it out.
All right. Chaladima says, I am very happy to be a part of this training and to gain such valuable insight from a biosafety and biosecurity expert like you, Augusta. I am a BRM expert at my institution. However, applying what I have learned in my workplace and continuing to contribute and learn more has been challenging for various reasons. What would you recommend for professionals like me who are working in different facilities and facing similar challenges? Thank you.
Okay, thank you, Faith, for reading that. Thank you, Chaladima, for your question. If you're a biorisk management expert, I believe you are working in a laboratory. So for opportunities, I think you can. So there's something I do. I have my 9 to 5 and I have other things that I do. So if your 9 to 5 is not exactly in the field that you want to work in, you can take short courses that would sort of bridge the gap between where you are and where you want to be. That's why it is important to key into some of these global health network learning facilities, key into Future Learn, the network as well. You can take on courses that you can, first of all, identify areas where you need to be in. You are in point A and you want to be in point B. Find courses that would give you knowledge about what you want. There are so many free courses. There's Future Learn, there's the Global Health Center for Learning and Training. You can take courses on there that will give you knowledge that you need to advance your career. And then you can apply for different roles, you can apply for different jobs, you can apply to fellowships now and say, okay, I work as XYZ in this facility. I have a biorisk management, certification. I have taken courses on XYZ and I want to apply for this. So these are courses that can improve your chances, improve your knowledge, and improve your application, improve your skills to apply for roles that you might want in the future. So you need to identify those things. What do you need to get to the next point? What do you need to get to be a biosecurity expert since you already have biorisk management certification? So you can identify things that you need, or courses or programs or fellowships or even conferences that would make your CV more robust to make you the expert in whatever field you want to transition into. So I think the first thing is to go back into the drawing board and identify what areas or what skills you need to develop and then work on that. Hope I've been able to answer your question, Chaladima. Okay,
Oh,
I see you clapping, so I hope that answered your question.
yeah, thank you very much for the wonderful questions being asked. I think we do not have more questions. I have one last question before we close up the webinar. I can see a lot of people mentioning medical laboratory scientists, microbiology, and I would like to ask our guest speaker, are there any particular disciplines or backgrounds that are especially valuable that in biosafety and biosecurity? Or is he interdisciplinary? Is he anybody that can work in the global health security space? Or does it have to be people with a scientific background?
Thank you so much, Faith, for that question. Biosafety and biosecurity is so interdisciplinary. So you do not have to be a microbiologist. You do not have to be a medical lab scientist. You can have a first degree in public health. You can have a master's in global health, and you can work in the space of biosafety and biosecurity. Like my slide shared, there are public health advocacy roles you can take. You can even be a data analyst within the space of biosafety and biosecurity, because global health is evolving every day, and we see how the world is interconnected. We see how one health, animal health, environmental health. You can be an environmentalist and work in biosafety and biosecurity. You don't need to have ever entered into a laboratory to be a global health security expert. So to answer your question, Faith, no, you don't have to be. You don't have to have any specific scientific background to work in biosafety and biosecurity. Funny thing is, during my master's program in public health, I met so many people from the business side that were taking courses on public health, people from finance, people from agriculture. Anybody can have a career in global health security. There are teachers, you can be an educator, you can be a data analyst, you can be an AI person, and also have a career in biosafety and biosecurity. Someone has said, how have I been able to answer your question, Faith? I see another question on how can one get access to fellowship programs and short courses. So Ibikunle patients, the slide will be shared, and in the slides, once again, there are hyperlinks. You can just click into those links, go through the website, and if it's something you're interested in, you can apply. Some of them still have submissions open to June. Some of them have submissions open to September. And if this year is closed and it's something that you're really interested in, like the Youth for Biosecurity Fellowship, you can apply next year. And while you're waiting for next year to come through, you can start working on your application. You can start drafting your essays. You can start talking to your references. So these are ways that you can get access to the fellowship program. So all the links will be provided in the slides that will be shared. You're welcome. I think
Okay.
so.
Yeah. Soma, your hand is raised. Please unmute and speak.
Thank you very much. So my question is for the organizers. As we are speaking about network, I don't know if it is possible to create a WhatsApp group in order to share some information, some important opportunities for us. And I think, as he say, only one application, with one application, you can get many opportunities. So I think it is I can say it is an opportunity for us now to get network, and if it is possible to have a WhatsApp group in order to share information, to share application, it will be important for us also. Thank you.
Yeah, thank you very much for that beautiful question. Yes, we do have a network. We have a WhatsApp group that we share opportunities like this. If you are interested in joining the WhatsApp group, we did not make it so open due to security reasons. So we are going to share you an interest form via your email address that you use to register for this webinar while alongside the presentation slides. So we're going to share you the interest form. If you're interested in joining the WhatsApp channel, please fill in the link and we will add you to the WhatsApp group where you can get other opportunities. Yes, we do have a WhatsApp group. And I would like to also say that we would be opening up a call for volunteer very soon, and we'll be having a fellowship very soon. I just want you to be on the lookout, stay connected via our social media platforms, join the WhatsApp group, the network if you can. And if you don't have WhatsApp, if WhatsApp is not allowed in your country, just stay updated on our social media platforms so you will get all this necessary information whenever we release it. So yes, we do have a WhatsApp group. I hope that answers your question.
Yes, thank you.
All right. We've spent our time beautifully well, and I want to say a very big thank you to our speakers. In the absence of no more questions, I think we can bring the webinar to a close. So please, first of all, let's show our speakers some love. Use the emojis, use the love emojis, clap emojis, just appreciate her for her time. She could have declined our invitation, but then she accepted it, and we are not paying her anything. We are not giving her a dime, but she's here. So thank you so much, Augusta. We are glad to have you. Thank you for the insight. So right now, also to our participants, thank you for those beautiful questions. Those questions really shows that you want to learn and you are willing to be a part of this. So thank you so much. Right now, we'll be giving the closing remarks for the founder of the pioneer of this advocacy network in person of Dr. Judith Okolo is unavoidably absent. So I'll be taking the closing remarks on our behalf. So yeah, thank you so much once again to our speaker for this very insightful and inspiring session. We really do appreciate you. And of course, a very big thank you to all of you who joined today. Thank you for taking out your time, your presence, your questions, the engagement. So it's truly beautiful. And personally, I did enjoy myself. And also, we hope that this conversation has not just added to your knowledge, but it has given you clarity. You now know what step to take. You know the next thing to do after this, because it is quite a, should I say, a common thing for people to join sections like this, and at the end of the day, they don't make use of it. So I'm imploring us, after this webinar, don't just have it, don't just listen to it, take action. Write out opportunities, be intentional about them, give yourself deadlines, and through that you can harness the opportunities that exist in the biosafety, biosecurity, and global security space. Then begin to position yourself strategically, begin to take courses like our speaker has said. Also, at the Biosafe Advocacy Network, we remain committed to creating more opportunities. So be on the lookout for more opportunities to learn, to engage, to grow. And you can always reach out to us. You can reach out to us via our email address, the email at biosafeadvocacy@gmail.com, biosafeadvocacy@gmail.com. You can write to us, and very soon we'll be, like I mentioned earlier, we'll be opening up some volunteer opportunities. That is one of the ways to grow. Volunteer opportunities, you can be a part of it. And whenever we have our fellowship being announced, you can be a part of that as well. You can apply. So yeah, right now we have come to the end of this webinar. So we encourage you as well to stay connected on our social media platform at Biosafe Advocacy. Biosafe Advocacy on all platforms, LinkedIn, Instagram, social, Facebook, and all. Yeah. So thank you once again for your time. Again, to our beautiful speaker, thank you so much. If you can unmute your mics, please do that and tell her a big thank you. Thank you. We love you. Thank you for your time. Please, let's unmute our mics and tell our speaker thank you.
Thank you so much.
Thank you.
Thank you, Augusta. So right
Thank
now,
you,
I would love
Thank you
Augusta.
us
very
to
much.
say thank you. I would love us to take pictures. So if you can put on your camera, please do so. We wouldn't mind. We want to have pictures. We want to take pictures. So switch on your camera if you can. If you're unable to, that's fine. If you're unable to, that's fine. So when you're set, I will count 1 to 3 and I will take the shot. Are we set? Are we waiting for anybody? Put on your camera if you can. So at the count of 1, put on your best smile, please. 1, 2, 3. Yeah, that's it. Thank you so much. And please give us your permission. We're going to post this on our social media pages so you don't take us to court. Yeah, thank you so much. I don't know if Augusta has anything else to say before we call it a day.
Thank you so much, everyone, for your kind words and your emojis. Thank you for taking out the Friday evening to be with us. And Biosafe Advocacy Network is something that we should all keep an eye out for and benefit from, because they'll be sharing so many opportunities. So you can be a volunteer, just be close to where the information is coming from. So thank you so much, Faith. Thank you to the pioneers for inviting me. Thank you, Dr. Judith. And yeah, so that'll be it for me. Hope to see you guys next time. Hope I can bag another invitation soon. So thank you and have a lovely weekend ahead.
Definitely, we're going to bring you back. You're our celebrity. Thank you so much. All right, now we have come to the end of this session. And on behalf of the Biosafe Advocacy Network, I don't know if my colleague Emmanuel is here, and I don't know if you would like to speak. On behalf of Biosafe Advocacy Network, we say a very big thank you to you. Emmanuel, if you can speak, please just give a reaction or something. Okay, I guess it's on. I believe we can't speak at the moment. So, anyways, thank you and have a wonderful evening. Bye.
Thank you
Bye.
for the opportunities.
You.